Alright guys, good morning. This is going to be a tutorial on how to do your patient care reports on Platinum Planner. So let's start off now with your student homepage. I am logged in as a student, as you can see. You're going to go to your opportunities, my opportunities. You're going to find your ready to document ride, whether you're on the ride currently on that day or you had it within the last 72 hours. They'll be listed here. The upcoming rides will be here, all the upcoming rides and clinicals that you have to attend. But for right now, the ones ready to document are right here. Click on the ride that you're on. So for today's February 12th, I'm going to say begin documentation. Click here. This is your overview page. This is going to show you where, when, the times your ride is at or your clinical is at. The due date, by the time the 3 PCRs are due, is right here, due date. So make sure you pay attention to that. Next, you're going to click on the info tab. On the info tab, you're always going to click me as your preceptor. Okay? This will give me the opportunity, once you submit it, to CQI and check your reports to make sure you're doing it correctly. Hit save changes. Then you're going to go to patients. This is where you're going to document every patient. Remember, you have to have a minimum of 3 PCRs for rides, 3 minimum PCRs for clinical. You're going to add patient. And here comes up the tab. All your patients are going to be live. Anywhere where you see a red asterisk means it's required. So live, chief complaint, you're going to find your chief complaint here. If you cannot find your chief complaint, you're going to put unknown man down or unspecified. But for today's example, we're just going to go with abdominal pain. You're going to click the gender. And this is very important. Here's where you're going to type in the age of the patient. Once you type in the age of the patient, this will change this age group right here, which is going to add to your table when it comes to adult, pediatric, infant, adolescent. So if you see, if I change this to 6 years old, it changes to school age. If I say change this to 70, it's geriatric. Now, very important, whenever you see a green successful, you have to click on that because it'll add it to your skills. Team lead, always team lead. Now your pathology. Your pathology is going to be what your chief complaint system is. So if this one is abdominal pain, I'm going to come down here to pathology and find anything with abdominal pain. Now, if you don't find it, the system, you're going to click other medical conditions. So for abdominal pain, you can only find here. But if you had a cardiology patient, you can do cardiac dysrhythmias, cardiac arrest, OB, trauma, all that other stuff. So, but right now, this is going to be for abdominal pain, other medical, successful, and it adds it down here. Now, skills. This is very important because you have many skills you have to do throughout 9 months. You're going to click each skill that you do. So let's say we did an IM injection, successful. Let's say an IV bolus medication, successful. Anything else? Establish the IV, successful. Anything else you probably can think of? Let's say you pace the patient, successful. And let's say you did an IO also, successful. So you're always going to click successful, so it's all down here. Once your skills are in, now is where you're going to put the SOAP report, right in this section here where it says narrative and patient notes. With the template that I send you, you're going to open your template, and just like it says here, you're going to delete the bold. Delete the bold. Delete. And you're going to start to input your narrative. So, patient stage chief complaint is abdominal pain. Then you delete the bold. Patient states, whatever the patient or caregiver told you, patient states, pain began after lunch. And you input their allergies, which is your sample history, right? Let's say he's allergic to bees. Medication. The list of medications that the patient gives you or the caregiver, lisinopril and aspirin. Past medical history. Delete here. And then you put whatever it is, hypertension, diabetes. And then if this is a pain call, you'll be entering your OPQRST in this section. Make sure it's a thorough OPQRST. Next, pertinent negatives. Patient denies any loss of consciousness, shortness of breath, chest pain, abdominal pain. This is an abdominal pain call, so I'm going to come in here and I'm going to delete abdominal pain. Patient denies any drug or alcohol intake. And then for our trauma patients, patient denies head, neck, or back pain. If this is not a trauma patient, please delete this. Once you're done, you come over here, copy, go back to your report, and paste. Hit enter to go to the next one. You go back to your document, and you insert here. Now, upon arrival, if you're on a ride, you'd be saying Rescue 78 found whatever it is, 50-year-old male. Okay? If you're at the hospital, it wouldn't be Rescue 78 because you're at the hospital or Dr. G's. It'd be EEI student found in hospital room number, whatever number it is, or make up the number. Age and gender, make sure you're deleting the bold, located in what kind of position, and then AO times 3, Glasgow. This is where it's really important. Your vital signs. You have to have 2 sets of vital signs. Here's vital sign number 1. Here's vital sign number 2. Okay? Make sure you're inputting all the vital signs here. Here's your complete head to toe. Delete and subtract anything that you need pertinent for this call. Okay? Once you're done, you're going to copy and you're going to paste. Then you're going to go to your assessment. You're going to delete here. And remember, your assessment is just one quick sentence. It's always going to be possible, and then whatever your chief complaint is, abdominal pain. That's it. That's all you have to do for your assessment. Copy. Paste. And lastly, for your plan, you're going to come over here. You're going to delete the bold. Make sure you're deleting all these other bolds. Follow this plan here. Make sure you're putting in all your skills here and a second set of vitals. Now, if it's a ride, patient was transported to the facility that you transported to. If it's not a ride, you're going to delete this sentence and you're going to do the hospital sentence. Patient left in the care of ED staff. If you're at Dr. G's, patient was treated and sent home to follow up with their personal care physician. Once you're done, copy and paste. Once your whole SOAP report's done, you can submit. Save it, and then do your next 2 patients. Add patient, so you have 3 patients. Once all 3 patients are done, skip forms and go to documents. Documents, you're going to click drag and drop, and it's going to open up a window on your phone, your tablet, your iPad, your laptop, and you're going to upload your blue or yellow sheet as attendance. Once you do that, you click submit. And here is going to show you everything that you put for this call. These goals here on the right, 0 of 25, 0 of 12, 0 of 9, should show you your progress when it comes to IVs and things like that. Once everything looks good, hit submit documentation, and it'll send me an email saying that you're ready. It's ready for me to review. Now, once I get it to review, there's 3 things I can do. I can accept it, and it'll go into your program. I can reject it, meaning you didn't show up on time, you were sent home early, or I can ask for review. If I ask for a review, it'll send it back to you, and I'll send you an email stating what you need to correct. Okay? Now, when I go to check these things, if you are past the 72-hour mark, that is tantamount for you to deleting the write-up clinical, getting a write-up, and paying the fine. You must have a complete narrative, 2 sets of vitals, the attachment of blue and yellow sheet, and it has to be done within 72 hours. All right, guys? Remember, show up on time, be in complete uniform, and learn. If you have any questions, please email me. Have a great day.